next we're going to talk about over-the-counter medications, just some common mistakes and helpful tips for when you're shopping in the pharmacy. So first we wanted to talk about combination products. Combination products are something that can be a little bit confusing because there's such a wide selection of them, especially for things like cough, cold, fever, headaches, etc. The reason they're called combination products is because they contain multiple medications that are all used to treat different symptoms. So it's really important with those medicines to read the back of the box to make sure of which medications you're taking. So a good rule of thumb is to avoid taking 2 or more medications that treat the same symptom. For example, taking Tylenol and Dayquil or NyQuil together for a sore throat or flu would be bad because both products have acetaminophen in them. The maximum dose of acetaminophen for one day is 400 milligrams, or 4,000 milligrams, sorry. And 4,000 milligrams is equal to 8 extra strength Tylenol. So this doesn't include the 325 milligrams of acetaminophen and 15 milliliters of Dayquil or NyQuil. So then it would be very easy to go over the limit without noticing, and that can be dangerous for your liver. So another good rule of thumb is to always tell your doctor which over-the-counter medications you're taking, just so they're aware of it and they know if anything interacts. So then here's some common differences in cough and cold products. So you have Dayquil that has 3 main ingredients. It has acetaminophen for pain and fever, dextromethorphan, a lot of times you'll see that abbreviated as DM. So that's a cough suppressant. And then phenylephrine, which is a nasal decongestant. Then for NyQuil, that also has 3 ingredients, and some of them are the same as the ones in Dayquil. So NyQuil both has acetaminophen and dextromethorphan for fever and cough. And then NyQuil has doxylamine, which is an antihistamine that helps you sleep. Mucinex Sinus has several ingredients as well. A lot of similarities to the Dayquil and NyQuil. It has acetaminophen, phenylephrine, and dextromethorphan. But one that's different with Mucinex Sinus is that it has guaifenesin, which is an expectorant that helps you cough up any mucus that you might be having in your lungs.
Okay, and then another big section that you can see out there in the pharmacy is medications for children. So we're going to talk a little bit about child safety and medications that you can and can't use for certain age ranges. So some safe medications that we have over the counter would be acetaminophen or Tylenol, and you can use that for pain or fever in children that are 3 months of age and up. Then you'll also see ibuprofen, which is also called Mortar, and it can also be used for pain or fever, but that one you're not supposed to use unless the child is 6 months and up. We also have things out there like saline nasal sprays and drops for nasal congestion, antibiotic ointments like Neosporin or bacitracin for cuts and scrapes. And then we always want you to follow the weight-based dosing instructions on the box of these products you're using. A lot of times for weights and ages that are on the lower end, it'll say consult a doctor. One good thing you can do is always walk right over to the pharmacist over in the pharmacy section of the store. They'll be able to talk with you about appropriate dosing for your child. If you don't have time to do that, I guess your next best thing would be to consult your pediatrician and let them know that you have some questions about medications that you want to use for your child. Okay, and then some medications to avoid. You don't want to use aspirin in children and teens under 18. This can result in a serious illness called Reye syndrome. You also, it's now recommended to avoid benzocaine or Oragel. You don't want to use this as a teething agent in infants anymore. Children under 2 are at a greater risk for a rare but serious and even fatal disorder that reduces the amount of oxygen carried through the baby's bloodstream. Cough and cold combination products you don't want to use. They're not proven to be safe or effective in children under 12. And then laxatives. We want to consult your doctor if your child becomes constipated. Laxatives can disrupt the child's body's amount of water that they have, and they can easily become dehydrated if they start going to the bathroom too much. All right, how your pharmacist can help. Pharmacists are the drug experts. We can pick the right OTC product based on the symptoms you describe. If you ever find yourself in the aisle and you're like, I don't know what I should use, head on over to the pharmacy and the pharmacist would be more than willing to help you pick something for you. So pharmacists help you avoid taking products that have the same medication and make choosing a product out of several options easy for you. And then they know which medications are safe for you based on other medications that you take, and also which ones are safe for your child to take.